I welcome all colleagues to our conference. I present to your attention a report on the topic digital 3D technology in the assessment of LYVE-1 expression in patients with eczema, with skin eczema, against the background of type 2 diabetes mellitus. Due to the increase in the number of patients with type 2 diabetes mellitus, the problem of treatment of skin diseases occurring against the background of carbohydrate metabolism disorders remains relevant both for dermatologists and for endocrinologists. The development of dysfunctions of blood and lymphatic vessels in various tissues and organs plays an important role in the pathogenesis of vascular complications of diabetes mellitus. The lymphatic system is involved in the transport of tissue fluid, proteins, immune cells, lipid absorption, and cancer metastasis. Disorders of the lymphatic system can lead to edema and fibrosis. Recently, special attention has been paid to the study of the structures and molecular cellular mechanisms of the initial stage of the formation of lymph and the lymphatic system in various tissues and organs. And in our investigations, we show the role of pre-lymphatics in the development of liver function disorders in type 2 diabetes. Studies of the skin lymphatic system mainly concern lymphatic vessels stained with the LYVE-1 receptor. However, the morphological features of the skin lymphatic system and its roots, pre-lymphatics, in diseases associated with the presence of exudative processes in the epidermis and deep layers of the skin remain unexplored. Sorry. Purpose of the study was to carry out research on the morphological features of various links of the skin lymphatic system of patients with eczema against the background of type 2 diabetes, to assess the expression of LYVE-1 lymphatic vessel endothelial marker in the skin epidermis of patients using digital 3D modeling technology. Clinical observations of 3 male patients with eczema and type 2 diabetes were carried out. There were such methods: histological, immunohistochemical staining for LYVE-1 and 3D modeling of skin samples stained for LYVE-1 was performed using a nano laser holographic confocal microscope. Skin samples were taken from a lateral surface of the torso. And the next slide provides a step-by-step description of the indirect biotin peroxidase method. But I want to say that during all immunohistochemical reactions, negative controls were carried out, replacing incubation with primary antibodies by incubation with non-immune serum of the corresponding animal, rabbit serum. And about our results, all 3 patients were received treatment for eczema, concomitant diseases were type 2 diabetes, fatty degeneration of the liver. The skin disease proceeded with moderately pronounced clinical manifestations in the skin lesions from the unsharp boundaries were located on the back of the hands, in venia, folds, and trunk. In the foci, against the conjunctive erythema background, infiltration of skin and ocular vesicles was noted. Moisture was absent in all patients. in the skin of the patients, we revealed an uneven thickness of the epidermis, thinned in places and having moderate acanthosis. Vasodilatation, thickening, and increased permeability of the walls and swelling of the endothelium were noted. There were pictures of edema, both intracellular and intercellular, and in this case, the cells were separated, the intercellular connections were strained, and in some cases, torn. Separated patterns of acantholysis were observed. In some areas, spongiotic vesicles were detected in the stratum corneum of the epidermis. We noted edema, dilatation of capillary vessels in the papillary layer of loose fibrosis and connective tissue of the skin. Lymphatic vessels, their back arrows often started from the enlarged blind and were disrupted in the dermis, forming a network of dilated lymphatic vessels. Cellular infiltrates were detected in the dermis. In the endothelium of the lymphatic capillaries, we detected the expression of LYVE-1 defined as a pronounced brown color, black arrows. But we also detected the positive LYVE signal, LYVE-1 signal, in the cells of the basal layer and the spinal layer of the epidermis. There are blue arrows. That gives a reason to consider the intercellular spaces in this layers of the epidermis as pre-lymphatics. We observed intracellular edema, most pronounced between the cells of the spinal layer of the epidermis as a result of the penetration of serous exudative from the dilated vessels of the papillary layer into the epidermis. The phenomenon of spongiosis was noted in which the cells were separated, the intracellular connections were strained and in some cases broken. Under these conditions, some epithelial cells developed intracellular edema, which could later lead to the death. 3D modeling of the image of the LYVE-1 expression in the skin epidermis of patients with eczema and type 2 diabetes revealed clear boundaries of pre-lymphatics and confirmed that intercellular edema is most pronounced in the spinal layer of the epidermis. Using the nanolymph microscope software, we were able to measure the width of the intercellular spaces. The intercellular spaces can be up to 4 micrometer wide. Analyzing our results, the following facts should be taken into account. At first, LYVE-1 was the first identified as a cell surface receptor in lymphatic vessels. But now, to date, LYVE-1 expression has already been detected in sinusoidal endothelial cells of the liver, spleen, and lymph nodes in humans. Besides, then these colleagues, using immunohistochemical and electron microscopic methods, revealed the LYVE-1 expression in the non-sinusoidal endothelium of many other organs, such as the lungs, heart, and adrenal glands of rodents. And as for LYVE-1 receptor functions, we can say that LYVE-1 solve as a receptor for hyaluronan dendritic cells, macrophages, T lymphocytes, and ensures their delivery to the lymphatic vessels. But for us, interesting that other function of LYVE-1. On the other hand, LYVE-1 as a hyaluronic acid receptor is involved in the sequestration of this molecule. As for hyaluronan, the main ligand for the LYVE-1 receptor is hyaluronan or hyaluronic acid, which is the main component of the extracellular matrix and is also part of the glycocalyx produced by the endothelium. Most of hyaluronan properties depend on the size of its molecule. There are high molecular weight hyaluronan and low molecular weight hyaluronan. The first molecule exhibits anti-inflammatory and immunosuppressive properties, and low molecular weight hyaluronan is a powerful pro-inflammatory molecule. So we determined the LYVE-1 expression in the lymphatic vessel endothelium of both the papillary layer of the skin and the deep layers of the dermis. But we also detected a pronounced LYVE-1 positive signal in the cells of the spiny and basal layers of the skin epidermis in patients with eczema and type 2 diabetes. Previously, we found that skin labeling of LYVE-1 gives a pronounced positive signal in the cells of the spinal layer of the epidermis in patients with cutaneous mastitis. The results obtained in this study indicate that the cells of the spiny and basal layers of the epidermis may have LYVE-1 receptors, due to which they participate in the lymphatic transport of hyaluronan in the skin of patients with skin oxidative processes. Our observation has shown that the intracellular spaces in the spiny and basal layers of the epidermis should be considered as part of the lymphatic bed, the pre-lymphatics. This is indicated by histological changes in intracellular spaces, intercellular edema, and epidermal cells intracellular edema, as well as the LYVE-1 expression on the epidermal cell membranes of these layers. The development of such changes in the epidermis is facilitated by stagnation in the blood and lymphatic vessels of the papillary and reticular layers of the skin dermis, and by the formation of perivascular infiltrates. 3D modeling of the image of the LYVE-1 expression in the epidermis of the patient's skin revealed clear boundaries of the prelymphatics and helped to establish that intercellular edema was observed throughout the entire depth of the skin section, and was most pronounced in the spiny and basal layers of the epidermis. In the spiny layer of the epidermis, this led to the loss of communication between epithelial cells and their death in lymphatic areas. So our study allowed a new look at the molecular characteristics of the lymphatic system of the skin of patients suffering from eczema and type 2 diabetes mellitus, it was found that the epidermal layer of the skin, although located at the junction between the external and internal environment, plays a crucial role in maintaining the homeostasis of the skin of patients with eczema and type 2 diabetes. The detected expression of the LYVE-1 lymphatic vessel receptor in the cells of the spiny and basal layers of the epidermis, the use of tomographic analysis of preparations and 3D modeling of images of the epidermis and skin prolymphatics indicate that these prolymphatics are involved in the lymphatic transport of hyaluronan in the skin of patients with the presence of oxidative processes. At the same time, the functions of the epidermal layer of the skin are largely coordinated by the work of various parts of the lymphatic region of the skin, blood vessels, and connective tissue compartment of the skin. Thank you for your attention.